Welcome to Care Talk Shorts, where we take one important healthcare topic and cover it in depth. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
John, today we're going to talk about mental health, and in particularly mental health at home. And I'll just mention one of my very close friends, Danny, died this year. He had a long struggle with bipolar disorder. He was my best man at my wedding. So this is personal for me as it is for many others. And we talk about many others, John. I mean, how many people are we talking about here?
Well, first of all, I'm sorry for your loss. But David, your private pain is shared by many. 1 out of every 5 Americans is suffering from a chronic mental illness. And while we're doing a little bit better at reducing the stigma on that, maybe a lot better, there's still a lot of unmet demand for folks who are suffering from chronic mental illness. We're better off because of mental health parity. What that means is your insurer needs to give you the same access to mental health support as they give you for physical health support. That's all good. But we are facing a real crisis of supply of services with probably as many as 10,000 fewer mental health professionals than we need to actually help solve this problem.
John, I know that the closely related issues of opioid abuse and firearms, these are all tied in, suicide, all the big, real growth, and you haven't had the change in supply.
You just named 3 of the top 10 causes of death in the U.S., and those are the only 3 that are growing. Suicide's the obvious one in terms of mental health, but I would argue that mental health issues are woven into, clearly, the opioid deaths and probably firearms as well. These are issues that we need to deal with or more people are going to die. It's that simple. And I think we need to come up with new modalities and new pathways of support, including the home, that'll get folks the resources they need.
John, I think you're kind of a one-trick pony sometimes when it comes to the home. But I think in this case, we really want to see people to be able to move from an institutionalized environment where they used to be to the home. Unfortunately, I think that the deinstitutionalization in the 60s and 70s, well, people went from that institution, which was a terrible one, to another, prison, homeless shelter. How do we get people actually to home?
Yeah, no. Well, first of all, I'm a multi-trick pony, but I think that and I was involved in helping keep homeless mentally ill people off the streets by supporting that deinstitutionalization in Massachusetts many years ago. I think the way we do it is sort of what we were trying to do in Massachusetts many years ago, is to find settings in the home and the community where folks could get easy access to resources for that support of the transition to independent living. The moving people out of criminally difficult and lockdown facilities where they didn't need to be and giving them the tools to live independently, that made sense, but we didn't provide the backup and resources, which is why 1 out of every 4 people coming out of prison or in a homeless shelter has a mental illness that's undertreated or untreated. And I think we need to leverage the extenders that we've got right now to start address what is a real crisis of need in mental health right now. And if we don't leverage the home where people feel most comfortable, and we don't leverage family caregivers who can help monitor and support members who are going through difficult times, and we don't leverage technology, demand won't meet supply. And so we are advocates of services in the home, engaging family members and leveraging technology in order to start to staunch the flow of demand so we can actually get people healthy. And yes, we are advocates for the home, but we actually think it's one of the unlevered advantages that we can use as a country to actually help care for people.
John, I agree, being in the home is terrific, and I hear your point about, leveraging other people and technology and so on, but some of the technologies I hear about, like telehealth, video visits, it's convenient, but you're still kind of one-on-one with a doctor if you can get them. Is technology really an answer? How do we really help?
Well, it's an extender. So I think you'll find that for young people who are suffering from depression and anxiety, which is very common, you have a lot of comfort with self-training apps and text-based approaches. You're actually finding that many folks who are suffering from mental illness are very comfortable engaging with a computer or indirectly with a person because there's less stigma and less fear there. You're seeing better and better apps. Of 150,000 apps, mobile health apps that are available, 30% of them are mental health related or have those capabilities. And there are some that are really tied in or developed by great research institutions. And I think you combine that with a caring, informed family and a problem you need to solve in a place where people can heal, like the home. I think you start to extend and grow the resource base of support for people who are going through difficult times in mental illness.
John, I understand the point about the apps, a lot of people using them. Maybe people are more comfortable chatting with an app or a machine than an individual. What about older people? You know, certainly a lot of people that are isolated and maybe at home, they suffer from depression. What about them?
Well, it's a harder question. I think where technology and family members can be woven together with sort of more of a virtual care loop, but there's no question that loneliness and depression are a huge and growing issue for our isolated adults in many of our communities, particularly in rural communities. And while technology can help, that's where I do think we're going to have to just invest in more resources and also be aware of the day-to-day challenges of being a farmer in an environment with trade wars and difficult pricing. And if you're a farmer in a rural environment without a lot of resources and under a lot of pressure, I think part of it is becoming more aware of some of the day-to-day challenges of working class Americans and thinking through the mental health implications of an economy that might not be working for them. At any given time, people will be going through difficult times. We've historically been, as a society, very generous and supportive of where physical challenges have led to physical health needs. We haven't always gotten it right in mental health, and I think that's more of a healthcare strategy question. But there's nothing that's going to replace the need for a caring professional for those areas where someone really needs them. Technology in the home are extenders. They don't replace the need for more services to people who are suffering.
I mean, John, maybe last question. I go back to my friend Danny. He was in an urban area. He had a number of friends trying to look after him. Ultimately, it wasn't that much they could do. What are the couple things that are actually helpful to support such caregivers? I mean,
I think what it sounded like what you and your friends were trying to do for Danny were steps in the right direction. Identify the need and don't let any stigma attach to it. Make sure that where there's a drug therapy that works, that folks have access to it and they stay on that regime. Leveraging technology for support and communication, as well as potentially some self-healing applications, and making sure the family and community is involved. At the end of the day, we can address and support and solve some of these problems, but we're not going to solve all of them.
Well, thank you, John. That's it for this edition of Care Talk Shorts. We've been talking about mental health at home. If you like what you see, what you hear, please subscribe. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thank you.